Sustainable Food System Teams. Thank you so much, Amit, for joining us. Amit, coming to the point, I mean, on this World Health Day, we would like to discuss with you antimicrobial resistance. Why don't you tell us what AMR is and how does it spread?
Okay, thank you very much, Sukanya, for having me. It's a very important day. Just to let you know, it's a health day, yes, but the issue we are talking about is one health issue, which basically is much wider. So, and very important element that we should be talking about going forward. Now, to answer your question, what is AMR? I think all of us first need to understand uh, that AMR is about, and it's called antimicrobial resistance, which basically means uh, resistance in microorganisms uh, against the drugs which are used to treat them. For example, resistance in a fungus, in a fungus against against an antifungal drug. Resistance in a virus against an antiviral drug. Resistance in a bacteria against the antibacterial drug or antibiotic, which we normally call it. And out of all these, the most important issue is actually antibiotic resistance. And that basically means resistance in all kinds of bacteria or different kinds of bacteria against the different kind of antibiotics which are used to kill them or retard their growth. This is what is called antibiotic resistance, and that's what is a key concern. It is actually considered a big, huge global threat crisis. And now let us understand how it spreads. And before that, let me also share how it develops. So I think the viewers should understand that antibiotic resistance in a bacteria is actually a natural process. It's through the genetic changes that happens over time in bacteria, which make these antibiotics ineffective to treat them. Now the question is, so what's the problem here? And the problem is the misuse or overuse of antibiotics actually creates a scenario wherein because of which this resistance accelerates. So the development of resistance is actually, most of it is, or a large part of it is because we are not using or we are misusing antibiotics a lot. So that's one part of the development issue. Then of course is the scientific angle to this is, yes, a resistant bacteria will pass on the resistant genes to the next generation of bacteria, which is one part of the problem. The other part of the problem is that gene in a bacteria can transfer to other bacteria and make those bacteria also resistant to antibiotics. And this kind of scientifically it is called as horizontal gene transfer, and which is also a big problem. Coming to how it spreads, let me just focus only on the sector. So we typically say antibiotics in our mind, we relate it to the human health issue, but that's just not the only case. It clearly is much beyond human health. For example, perhaps not many viewers would know that antibiotic is misused or used a lot in the food animal production. When these animals are grown or reared, they are basically they are grown to treat. They are grown with a lot of antibiotics, and that's where the problem is. Which basically means antibiotics are used for growth promoters in let's say poultry. Antibiotics are used to prevent a disease which actually is not there, but to prevent the entire flock, which otherwise could have been prevented by some other non-chemical measures. That's the other part of the misuse. Similarly, in aquaculture, there could be a lot of antibiotic use, which is not needed. So clearly the food systems part is the other big part of the problem. The third major sector is the environmental sector. And the environment sector means that, let's say if I use antibiotic on my farm, the poultry the gut of the poultry will have those bacteria or antibiotics, which are otherwise resistant bacteria, or genes which can cause resistance, as well as antibiotics. The waste from a poultry farm will actually move to the food chain through the environmental pathways. Similarly, a manufacturing plant, which is manufacturing antibiotics, if they are not able to control their waste properly, and antibiotics are disposed in the water, in their discharges, then of course that can enter into food chain subsequently. Waste from hospitals is also a problem. So clearly, food, animal farms, factories are a big pathways, if I may say so, to be through which the antimicrobial resistance can spread.
So we understand that it is a global threat in some way, but then why is it called a silent pandemic? And can you explain a little bit like how it becomes a big global threat?
Yeah, I think a very good question, Sukanya. The central answer here is the fact that the nature and the scale of the problem makes it a big threat. Uh, we are here talking about not one virus which has caused, let's say, COVID pandemic. We are talking about several bacteria which are causing infections of several organ systems in human beings as well as in animals. We are talking here about a phenomena which has no boundaries. Uh, it's we have seen that in COVID. That's where that how what does a pandemic mean? And AMR is also therefore because it also can spread from nations to different nations, uh, uh, and therefore it is also called a pandemic. Now the question is why it is silent. Um, Very unlike COVID, one really doesn't get to know that yes, you have a resistant bacteria, or let's say a particular morbidity or a mortality that has happened is because of a resistant bacteria. So it kind of is silent, but it goes and it keeps on going underneath, under covers, but it doesn't really comes out in the open like COVID. And that's where we have to understand that perhaps the cumulative damage of this could be much more than the recent pandemic that we have seen. Because this is ongoing, this is happening. This is not like one acute episode in the history which has happened for a couple of years. No, this is happening ever since the antibiotics were introduced. They were discovered since 1940s, right? And the problem is this is growing. It's not static. Because the more we use antibiotics, the more we lose them. And that's essentially the problem. That's where it is a big crisis.
So what do you think are the challenges? As in, and what can we do?
Yeah, challenges. So there are challenges for different stakeholders. There are challenges at different levels. I mean, at the global level, we know that there are intergovernmental agencies, there are UN agencies who are actively working towards addressing this challenge, essentially to basically push nations, make them aware about the scale of the problem, about the nature of the problem, and what kind of action is required. And that's where a global action plan was developed, and a lot of countries therefore came forward to develop their national action plans.
Right. Will you be also explaining India's action plan on in terms of also what CSE has done?
Yeah, I can talk about that. Let me just go back to the challenges. So clearly challenges at the global level, and one set of challenges for the stakeholders who are coordinating the global response. That's one. But ultimately, I mean, as you also right now are pointing towards, is that it's the nations who have to act. It's the nations who have to respond to this. They are the ones who are going to face it. And I can tell you from my experience that low and middle income countries have their own set of challenges. They have to address this problem in a different way. The countries who have the resources, the developed part of the world, has their own set of challenges. So let me just focus more on the low and middle income country challenges. Clearly, there are usual challenges of competing priorities. We all have competing priorities. We know countries in the global south have the priorities of education, primary health care, nutrition, and within that you have to address this. Uh, there are challenges of research and evidence. How much do we know for us to be able to act? There are challenges of capacity. Let's say if I know what is the problem, that do I have the capacity and the resources to act? There are challenges of funds. All these are usual challenges. But if I try and understand two or three broad challenges, then I can clearly say, I think the first and foremost is the challenge of how you convince or how you make aware the politicians or the policy makers of a particular country, uh, for them to be able to understand that this is the scale of AMR. If you act, this is what you will get. If you do not act, this is what you will lose. So the scale of action, the scale of problem, and the cost of action and the cost of inaction, if they are able to understand them well, then perhaps they'll be able to mobilize whatever limited resources they have. So that's a big challenge. And part of the challenge actually comes from the fact that do we or are we able to understand or communicate the problem of AMR to the policymakers in the right way? That's one part. The other big challenge is the challenge of growing population and growing demand of food production, and particularly the way we are growing food. There's a notion that we need, there's a notion, I mean, there are estimates that we will have so much population by 2030, 2040, 2050. And we would need more food, and this kind of food needs more industrial way of producing food. Now, the industrial way of producing food is essentially chemically dependent. It is resource intensive, yes, but it is too much dependent on chemicals. And we know that a lot of pandemics historically have come from the industrial way of producing food animals. And that's where we have to be cautious. Now so we need to basically be able to produce food for a growing population in a way which is sustainable. And how to do that will be a challenge, but we'll have to fight that, figure that out. That's the second part. The third most important challenge is our understanding on waste, our understanding on environment. Are we able to handle the waste in a way which makes the waste AMR safe? Right? We know that yes, countries like ours need natural organic fertilizers, but can the dung or the manure of the animal farms is safe enough for us to be able to use that and utilize the benefits of circular economy or circularity? So whether we are able to how we are able to manage our waste and make it AMR safe is something that will be a big challenge. And here the environmental dimension becomes a big issue because people typically are not really aware about the environmental aspects, and it has historically received very less attention. So in my view, these are the three challenges. One big challenge in my view for the global, for the developed part of the world will be and should be addressed is responsible consumption. Whether responsible production is the only one that will address the problem, in my view, no. Unless we also address the responsible consumption, that's where we have to, that will be perhaps a more a comprehensive or holistic way to address the problem. Okay, yeah, so coming to your point on what India is doing or what CSC is doing. So clearly India has a national action plan, we know that. But we also know that a lot of ground needs to be covered. The good part is that we are moving towards state action plans. Yes, some of the states have developed action plan, but of course, a lot of states still do not have that reach to that extent. But overall, we will have to mobilize our resources. We will have to really make it a One Health or multi-sectoral response, so that the action is really seen on the ground. And that's where a huge amount of work is required. What CSC has been doing, as you also know, that CSC's focus has been on the animal and the environmental dimensions of the AMR. We have been trying to address the issue, create awareness for the last about over a decade now through our laboratory studies in honey, in chicken, so on and so forth. We have been trying to advocate for the right kind of policies, right kind of standards. We have been trying to build capacities of stakeholders from the states, but we have also been trying to address, to inform the global policy making from whatever we are learning from our part of the world. As you know, we're also working in India, and we're also working, engaging with several other global countries of the global south. There's one very important challenge which I also want to highlight. That is, all this what we are talking about is happening, but it is increasing, or it is bound to create much more problem, because of the fact that for the last so many decades, we really do not have a very great development around the new drugs or the new antibiotics. And the pipeline of drugs that we see, the pipeline of antibiotics, is also not very promising. And that's where we have to also now focus on. So,
Okay, just one final question before we close. Mostly AMR, we also have the World AMR Week every November. It's for the as an awareness movement. What as individuals, do you think anything that is there? Do you think there's anything that individuals can do?
I think as an individual, and that's where this problem is different from let's say many other problems. I can contribute to air pollution, to not cause air pollution by adopting, let's say, a vehicle which is not based on fossil fuels. What can I do on AMR as an individual is a very tough question. But the fundamental point is that yes, I should basically be more aware about when to use antibiotics and when not. We know that most of the times there's a lot of overuse happening because of the prescriptions of antibiotics given to us. Are we creating that kind of pressure for the medical professional to write us antibiotics? We have to be mindful of that. A lot of infections, let's say for the upper respiratory tract, and of the let's say the diarrheas also are viral in origin, but we are consuming a lot of antibiotics. So we need to be more aware about what kind of antibiotics and how and what kind of antibiotics and do we really need antibiotics at its first place? And if we are prescribed antibiotics, are we taking the full course or are we leaving in between? So that kind of awareness will help. The second, of course, is we may have to now start talking about creating environment or creating a citizens movement or a citizens pressure to have food production systems which are not really producing food by using lots of chemicals. So we should be actually calling for a much more chemical-free food or antibiotic-free food, if possible. These are the two things that come to my mind right now.
Okay, thank you so much, Amit. That's all we have for today. Thank you all for joining us today. All right, bye-bye. We'll come back soon with another episode of CSE Live Chat. Till then, bye-bye.
Yeah, thank you very much, Sukanya.
Bye-bye.